Dr. Shluper, tell us about sealants for children. Are they really very valuable? And by the way, are sealants also used, can they be used for permanent teeth and for adults? Do they have any value there also?
Yes, definitely. Teeth do have their grooves and channels, and in those grooves, food gets accumulated. And sometimes we cannot brush it correctly. So ideally would be to block those grooves to prevent any trap for the food to be in. And they would prevent the teeth from getting decayed. So we do need the sealants to be there, and we would like them to be on every tooth that has grooves.
Which is mainly the teeth in the back, the ones who have a flat surface with which we basically chew, right?
Yes, the teeth are not as flat. They are quite wavy and very much filled with grooves.
Right. And how long does such a sealant? So basically, the sealant prevents cavities to go in, right? Because the bacteria, the dirt, the food gets stuck in the groove, and the grooves are so small that yes, food can go in, but toothbrushes cannot go in. That's basically the idea about it, right?
Yes.
Now, how long does such a sealant last once you put it on? A few months, a few years? What are we talking about here?
It varies from person to person, but most sealants, they do not stay permanently. Usually you have to check them once every 6 months if everything is still alright. And you don't want the sealants to be lost. If they are, we would like to keep them. If they did come off, we would like to put a new one before the cavity is created.
So you need to check them every 6 months, or you need to replace their gone every 6 months, pretty much. Because I've heard some people saying they last, sometimes, quite a bit longer. And it depends, if you have a person who eats chew gum all the time and chews on nuts and stones daily, he obviously will wear them down a little faster than a person who doesn't do those things.
Yes, we would like to keep them for as long as possible, and if they come off or wear out, we would like to replace them.
And on a 6 months regular checkup, you kind of see, just like with checking your tires on your car, you go every whatever so often, and the guy says, no, you're still fine for another 4 or 5 months or whatever it may be. Or he goes, it's time to do it, right? Something like that.
Exactly. And you should also check whether the sealant broke, and you may discover that actually there is decay underneath the sealant. So it's important to check them.
I see. Okay, so the monthly, the 6 months kind of whatever checkup is important. Now, what about adult teeth? Like, a person who's 20, 30 years old, older, like me. Would a sealant still be of an advantage or not really?
Yes, the sealants are beneficial at any age.
Really?
Even for adults. They do prevent cavities. And we would like to keep them. We would like to protect the teeth.
I see. So I don't have sealants. As far as I know, I never had them. I'm not so sure that's true. But by the way, did they exist 50 years ago?
They existed, only that the procedure to do them was more destructive than...
Yeah. I got it. So I know I didn't have them. So I don't have them now. So... I would still be benefit from him. It would still, ensure that I get less or no cavity in those teeth I now have. Is that what you're saying?
Yes, you would benefit if you would have sealants. Only there is a correct way to do that, and there is an incorrect way to do that. If in the past people used to drill into the grooves of the teeth in order to place the sealant. It's a wrong way to do that. You don't need to grind or to drill any tooth in order to place the sealant.
Well, was that because of the technology at the time demanding it? That now the technology, the sealant seals better and sticks better to the tooth, that's why they don't have to do it anymore? Or was that just a misconception of dentists?
Exactly. It's more of the misconception. The dentist used to prevent decay by drilling into the tooth. He would be better off if left the tooth alone.
Right. Sometimes we do have a tendency to engage into a cure which is worse than the illness in itself, right? So I got it. So, all right. Well, wonderful. But today most dentists know about that and don't engage in this type of thing anymore. Am I correct there?
I sure hope so.
All right. I got it. Well, Dr. Shluper, thank you very, very much. Bye-bye.
Thank you, Herman.